Really excited to have folks on the call tonight and people listening to this recording because it's an opportunity to discuss several initiatives from here at the Executive Office of Health and Human Services, or what we call EOHHS. We're going to share information both about Medicaid and an exciting program to help people who use home and community-based services. By that, I mean those people who are either living at home or in the community who need to access services, people who may have previously been in long-term care settings but are shifting. So I'd first like to share some welcomes. I'm Sam Swetchkenbaum, and we have James Rajat. And James, I'm going to let you kick it off with a welcome from the Secretary.
Thank you so much, Dr. Z. I will attempt to be brief. But first, good evening to everyone who has joined today and tonight, and those who are watching this as a recording. First and foremost, thank you for joining, and thank you for coming to hear what I think is one of our most exciting opportunities moving forward related to oral health transformation. I'm happy to kick this off in partnership with my colleagues here tonight. My name's James Rajat. I'm the Director of both Strategy and Innovation here at the Rhode Island Executive Office of Health and Human Services. On behalf of Acting Secretary Anna Novaish, who could not be here tonight, I do want to say again her thanks for being here, her continued gratitude for the work that our dentists are doing, particularly in our Medicaid space, but overall throughout Rhode Island to improve population health outcomes, and particularly after what we know was a taxing response to COVID-19. As a brief background, EOHHS is the principal state agency that's responsible for managing a variety of our sister agencies and their portfolios of work, including the Departments of Health, Human Services, Healthy Aging, Veterans Services, Children's Youth and Families, Behavioral Health Care, Developmental Disabilities and Hospitals, as well as being the single state agency to administer our Medicaid program. Last year, EOHHS and our sister agencies provided direct services to over 300,000 Rhode Islanders, as well as an array of regulatory, protective, and health promotion services to our communities. I want to first take a minute to acknowledge the Oral Health Transformation team who made this series possible. Dr. Sam, our Rhode Island Dental Director, Sadie DeCourcy from the Department of Health's Oral Health Program, and Sophie Asa from EOHHS, as well as Rachel Mulvaney, who has been our public health epidemiologist in this space. It truly has been a team effort, and thank you for organizing this series. I also want to thank publicly the Rhode Island Dental Association and their executive director, Christy Durant, for their continued collaboration with EOHHS to support our dental providers, our patients, and to promote increased access to oral health care services for all Rhode Islanders, but particularly those that remain in need. And most importantly, I want to thank you all again as our dentists and our dental providers. Your work and dedication to provide care to our community has not and will not go unnoticed, especially as this pandemic required you to evolve and change your practices, adapt in new ways, take on additional burdens and costs, and to which that you rose to the occasion. We know that there are various dental access issues, even in our small state, and many factors that play into those. And that includes the location of where our dental offices are, the need for more dental providers in the long term, the education of patients and the assistance of patient navigation to your clinics. And we know that there are a lack of providers who historically have not accepted Medicaid benefits, much of which was due to a variety of concerns. However, I am proud that as EOHHS, as the Medicaid program, and in partnership with the governor's office, we're able to improve the adult dental rates in the first time in over 30 years this last year. This town hall is the first of the series to try to address some of these access issues. You will hear from the team throughout the presentation, so I will not steal their thunder. We are involved in multiple agency workforce efforts to strengthen our state's healthcare system and to further improve our dentistry system. We believe that this is the time now for this transformative opportunity to use new methods to improve our system, to listen to you all and get feedback about our planned approaches. And I encourage you to consider joining us in this movement. We know, for example, there was a lot of transformation that happened in the physical health and primary care world that spun into some of the pharmacy space. Most recently has been focused on behavioral health and substance use, and we know that it is important to do the same for our oral healthcare system in the state. I hope you leave this town hall feeling informed, inspired, encouraged, and supported. And with that, I will turn it back to the team and say again, thank you to all of you for being here. Sam, back to you.
Oh, thanks so much, James. And I also wanted to say that our Medicaid director, Kristen Souza, also wanted to be with us, and she sends some greetings. We are very fortunate to have a director who has great understanding of the importance of a strong Medicaid program in support of oral health. And she also recognizes the challenges that the dental community has had over the years. And we're very grateful for her support to have the improved Medicaid rate, to have the rate increase, and also the efforts to get more dentists involved. She recognizes that we need a program that is sustainable and that it serves Rhode Islanders in need across the state. She's also open to creative ways to achieve quality care and better oral health. So as James shared, this is the first of 3 sessions. In this session, we're providing an overview, some things you are aware of, some things you may not be aware of. The next session in a couple of weeks, we want to hear from you. We want to hear your feedback on the program, on the manual, and what are some challenges you have. And then in the third session, we want to share with you some strategies which we hope will be beneficial as you work to help your patients. We're very grateful for the partnership of the Rhode Island Dental Association, and I would like to now welcome Christy Durant, Executive Director of the Rhode Island Dental Association.
Good evening, everyone. I just wanted to quickly introduce myself. Christy Durant, the Executive Director for the Rhode Island Dental Association, and thank everyone that is on this call, particularly in conjunction with the Executive Office of Health and Human Services. We've been working together for the last number of weeks to try to, vet through some of the issues that have come up in dentists participating in the Medicaid program, obviously the reimbursement rates, but other things that have come up as far as challenges. And we'd really like to see more providers participate in dentistry and in accepting Medicaid. So, we'd encourage everyone to participate in these calls. Those that are on the call, if you could share it with your friends and the recordings, and certainly reach out to our office to discuss anything you hear on this call and have further discussion on issues or questions that we can then share back with this team. So again, thank you to those that are on this, and thank you to EOHHS for working with us on extending the care to all in Rhode Island for dental and oral health care.
Thank you, Christy. And we really appreciate the conversations we've had, because you're getting input day in, day out from patients and from providers. And you've shared with us the number of times you get calls from families who need perhaps a provider to come to their home, or perhaps a provider who can inform them that they have access, improved access in their office. So it's a process, and it's been great to have your partnership. So now I'd also like to welcome from the American Dental Association, we have Jane Grover. Jane, I've known for many years from when I was at University of Michigan, and I'll let you bring welcome from the American Dental Association.
Thank you so much, Sam. And as Sam said, we knew each other back in Ann Arbor. This is an extremely critical topic. The American Dental Association, particularly the Council on Advocacy for Access and Prevention, is all in on Medicaid, particularly when states have made the effort, taken that first step to try to make things better. And this is where it's important for dentists to engage. And I don't know if the former chair of our council, Dr. Jessica Miske, is on yet, but she is a private practitioner, pediatric dentist in rural Nebraska, and has 4 practices, and will let people know how important it is when parents get care, kids do better. And so we're going to share a few strategies with you tonight that enhance advocacy, because this goes a long way with the legislators, but also health equity. But let's talk about how you can make it work. And we've got a prime example with Dr. Miske on how she makes it work as a private practitioner, how she's not only surviving but thriving. And I don't know many people that have the cell phone of the governor of their state, but she does, and certainly makes things happen. She's also the vice chair of the Presidential Medicaid Task Force for the ADA, so she's right on the front line. So why should you care? We hear this from so many practitioners. I was in private practice myself for many years. I had 9 employees, did all my own payroll. And prior to going to an FQHC for several years, I saw both sides of the Medicaid spectrum. It can be challenging to see adults that have had a lot of unmet need, but you need to remember a few things. That you can make a difference, a huge difference, not only in the life of that adult, but in the lives of every child that is influenced by that adult. And it could be a parent. I have a friend that owns 10 McDonald's restaurants, and he said, I can't put people on the window. I can't put people on the counter. I can't have people calling off because they have a toothache. So he was all in on oral health. So you as the leader in your community, you don't have to take everybody, but it's important to take a few because of the impact that it makes, not only with that patient and that patient's family, but the opportunity that you have to provide letters to the editor of your local newspaper on why oral health is important, the importance of adults receiving adult Medicaid benefits, the information that you can share with us as you treat a few families, and it might be 10. It might be 12 adults, but not only are you changing their lives, they're changing your life because the impact is so huge. It builds visibility within your community. And by visibility, I mean that people will step forward, agencies and nonprofit groups will step forward and say, can we pay the lab bill for that adult? I don't know how many of you work with veterans. I would bet you see a few of them in Rhode Island. But the impact of treating that patient and sharing that story with local media, with the patient saying, I had no idea that Dr. James was going to be so important to my getting a job, to my being able to celebrate the holidays with my family. This builds your brand as the leading advocate for oral health in Rhode Island. I remember sitting in on a Oral Health Coalition presentation at a event in Rhode Island, and the lieutenant governor happened to be sitting next to me. This was a breakfast, and there was a discussion of oral health, and he leaned over and said to me, you know, I'm just here for maybe 20, 30 minutes. I just want to see what people are going to be talking about, and then I'm going to leave. Well, the person who was talking was an oral surgeon, talking about what he was seeing in the hospital. And for the next 90 minutes, that lieutenant governor never moved. And he said to me, I had no idea. This is what you can impact in your community, building visibility and using this as a leverage point to make sure that kids get care. There was a nice study done in California that showed that when adults have care, children have more consistent care. Their outcomes are better. The whole family has compliance. When you have family-centric care, this is an opportunity to leverage right from now, right through and including National Children's Dental Health Month. You can be on a TV or radio show. You, doctor, can be talking to the local newspaper reporter about why oral health is important. And the legislators see that. Your Medicaid dental director, your state Medicaid director sees that. And there you are, uplifting oral health. And it's being an inspiration to a whole lot of people. This is also what Dr. Miski would offer, is the health equitable portion of your encouraging dental careers among underrepresented minorities. And you've got a lot of leverage here in treating a few adult Medicaid dental patients. Action for Dental Health passed in 2018 in December, was signed into law, and it allows the HHS secretary, in consultation with some other important agencies, to award grants or contractual cooperative agreements with oral health professional organizations. That would be the Rhode Island Dental Association, in conjunction with a nonprofit that has received previous HRSA or CDC grants. Got a lot of opportunity here to implement activities, have those funded, collect data, continue to tell that story of why there are barriers to oral health services and how those barriers can be reduced. Health equity is a major force going forward, not only for Medicaid, as Natalia Chalmers, Chief Dental Officer, tells us, but also for HRSA. These are the folks that fund the health centers. And to have a dentist in partnership with a health center working on a collaborative agreement is just another way to move oral health forward and show that the dentists are the leading advocates for oral health. ADA takes Medicaid very seriously, and that's in our shop, the Division of Government and Public Affairs. Mr. Mike Graham is our Senior Vice President. And we have built within CAP a Medicaid Provider Resource Guide. That is online. That is something that you can tap into. We also have a wonderful group of consultants who can walk you through how to do this and maintain your sanity. Although I would say Rhode Island's taken a big step in helping you do that. We are also working on a culture of safety, regional boot camps. The regional boot camps are for dental students. They are done at dental schools. Over 30 were done last year with students from across the country to let them know that Medicaid patients are real people. And sometimes, especially in this economy, sometimes people that have Medicaid transition into private insurance. And I saw that every day at the community health center, people that had fabulous public insurance, but they were just so used to coming to the health center because they had Medicaid once upon a time. This transition piece is something you can help with. We also have a public practice readiness module for students and new dentists, because so many of them rotate through FQHCs as part of their dental education program. So why is this really important? I mean, we know why it's important, but this is why it's really important, because you have hospital partners that you may not know that want to help you, and they want to help you very badly. Now, we've got models of ED referral, and in Michigan, where I'm from, where I'm licensed, there was a local social worker who worked with a small health department dental clinic and reduced the ED usage for adults accessing a emergency department in a hospital. She reduced that by 70%, 70. And she did it because she formed a dentist's partnership between the hospital and the local private practitioners. We've got the American College of Emergency Physicians that we count among our closest friends. They have approved our development guide. We've got models that any locality can develop. Those templates come in pretty handy, especially if you want to connect, you want to better connect patients from the hospital ED to your practice. The physicians appreciate this greatly. The hospitals appreciate it. This is where you build friends. And bear in mind that the people with private insurance, most of them work at hospitals, only about 62%, 64% of those individuals actually use it. When they get to know you, when they get to see you, when you do a 15, 20-minute presentation at the hospital ED department meeting, they feel they know you. And then you may be seeing patients from that department, from that hospital, from their families. So I was at the ASDA meeting, the ASDA leadership meeting this weekend at McCormick Place in Chicago, and they had a breakout session on building your brand and becoming a community influencer. Guess what? This is another way to do it. And it starts with being very kind, professionally ethical, and treating a few families in a Medicaid program. And I think this is about it. We certainly want to hear your stories, the patient voice. And this is where it's extremely important, particularly as we are in an election year and new people are elected, and they may not realize what the oral health world is all about. It's the holiday season. It's a great chance to have an open house at your office. Invite local stakeholders, invite your small business community, invite your state senator, invite your United Way agency, invite some of the outreach people from the hospital. You'd be amazed at the people that show up and then want to help you move this forward.
And I'd like to welcome Dr. Mieske from the great state of Nebraska.
As Jane mentioned, I'm a pediatric dentist in rural Nebraska. I'm the senior partner of a group practice with 4 clinic sites that span 500 miles. Fortunately, I don't have to see patients in all those sites, but each one of those sites is a significant and meaningful provider of Medicaid services. And you might be asking, why does a pediatric dentist care so much about adult Medicaid? Well, really, there are 3 reasons. One is eventually our pediatric patients will transition out of our practices, and we need a place for those older teenagers to go. A good example of this would be our patients with special needs. We know there's a certain number of those adolescents that will always have Medicaid because of their medical circumstances. And it can become very, very trying when you can't find a general dentist to transfer that care to. Second thing is, we know when the adults are seen, their dental IQ goes up. So as you're visiting with your adults that have dependent children, maybe they're caring for grandchildren, maybe they're foster parents, when their dental IQ goes up, it helps them better understand why they may be at risk for dental disease, or why the kids that are in their care may be at risk for dental disease. And then the third thing is if you don't have a healthy parent or caregiver who's at home with toothaches, who's missing work, they can't take their kids to things. They can't be that parent that helps out with homework. And I will tell you, I've been in this business for 23 years. Nebraska does not have the highest rates of Medicaid, but in order to be successful, the key is to look for other dentists in Rhode Island that have been successful with Medicaid, sit down with them and ask them, what is it that you do that helps you to be successful with these patients, allows you to do it in a way that you can meet your costs and a small margin of profit, and just getting tips and tricks on how do you minimize no-shows. I do not have a problem with no-shows. I had 62 patients today, and I wished I would have had no-shows. I'm just absolutely exhausted, but that can be very typical for a pediatric dentist when you don't have a lot of help in your community with other dentists that are comfortable seeing Medicaid. You know, just the final thing that I'll say about it is I do a lot of orthodontics in my practice. That came out of necessity because I did not have local orthodontists that felt they could help us out with Medicaid patients. And for those of you that might not be aware of orthodontics with kids, there's pretty strict criteria. You're not tipping and turning teeth and closing diastemas. That's not what medically necessary ortho is. It's doing things like impacted canines, congenitally missing teeth. Well, what I found out is the majority of my Medicaid kids from my Medicaid families that were not in that group of Medicaid, that were the poorest of the poor, literally with food insecurity, housing insecurity, but kind of that group that just has a small income. Maybe they're full-time students. They've been coming to your practice for years. I would tell the family, this child does not meet the criteria for medically necessary ortho, but if this is something you want to pursue, I can help you through working out a payment plan. And I would say about 1/3 of my orthodontic starts are Medicaid families where Medicaid would not pay for the case and the family is paying 100% of that. So my point is, don't write off the population of Medicaid simply because of their Medicaid status. You're going to find, just like Jane said, many people will go on to purchase non-covered services. They'll end up with a private primary insurance. Medicaid is a secondary. And as they reach stabilization, better paying jobs, more education, there is quite a number of those patients that'll end up with private primary, and they will eventually no longer qualify for Medicaid. What I find also is a lot of those kids on Medicaid in my area, particularly my Hispanic families, will go on to be first generation college students, get good jobs with good benefits, bring their kids in, look for general dentists to take care of them or their kids. And so I just find a lot of dentists write it off right off the bat because maybe they had a bad experience. Maybe they dealt with some no-shows, some low fees, but I just really want to commend Rhode Island for taking this important step to beef up your adult Medicaid. It's great.
Thanks so much, Jessica. Those are some really critical points that you brought forward, especially the fact that they both grow up and having parents who are educated will make a big difference. If the parents are getting the care, if the parents aren't getting the care, it's less likely that they'll pursue it for their kids. So
yeah,
great.
And just one thing I want to end with, Sam. When I have a bad day in the office, maybe I'm running behind, maybe I wasn't able to complete treatment on a kid because of behavior. Maybe a parent wasn't very happy with me, even though I thought we made a Herculean effort to get out an abscess baby tooth. A bad day for me may mean that things just didn't go along like clockwork and it wasn't just a great and perfect day in the dental office. And all of us know who practice, you're going to have those days. But a bad day for a child or an adult with Medicaid can really look quite different from that, whether it's maybe they're dealing with somebody in the family who's critically ill, someone who's been incarcerated, all of a sudden a vehicle doesn't work. Believe me, the last thing they're thinking about is a dental appointment. They're worried about losing their job. And so what I think of is when I worked 5 emergencies in today. These are people without appointments who showed up with toothaches. We alleviated every single toothache today. We didn't get comprehensive care done, but they will have a pain-free Thanksgiving and I won't get called in, which is also important. But I will just say that, if you've ever lived with a toothache or dental pain, I just had my very first toothache where I had to have a root canal. That is not only ruins your day and your night, that impacts everything you do. And for us, it can be so simple just to take out the tooth that is abscessed, get them comfortable until you can help figure out what are next steps. And so I wouldn't do it any different, but I've been doing this a long time and I don't have any trouble retaining my staff. I think they see the value of what they do every day, and it is a huge motivator for them knowing they're making a difference in these kids' lives. Thank you.
Thanks again. So we're grateful for your presence. We're also grateful for those dentists who have been participating in the Rhode Island Medicaid program in the past and currently. So, and again, it's a great way to improve the oral health for underserved and vulnerable populations. We'll have the opportunity to hear from some current Medicaid providers. The idea came from a meeting I had with a recently retired dentist. He had a successful practice here in Providence. I asked him why he participated in Medicaid, and he told me that it was his way of giving back, but while the bulk of his time was doing cosmetic and preventive care for patients who did not have Medicaid, he felt great satisfaction for helping those with significant dental needs. He also wanted to share that in the long term, it also helped his practice. Many of his patients were relatives of those with Medicaid or even those who were previously covered by Medicaid and now they had commercial insurance. He also shared the importance of everyone playing a role, the entire Rhode Island community. He also told me that he had participated in events such as Mission of Mercy, and while he gained great satisfaction and felt like he was helping people with great need, he felt it is important that this care be available more than just 2 days a year, and he recognized many had needs beyond what that weekend could provide. So we need a dental care system that is available throughout the state. and we're grateful for those partners who've worked hard to share the importance of adequate reimbursement and have worked to improve the rates. So we're grateful again for the input from the Rhode Island Dental Association. So the other input I got was from another dentist who wanted to share. So I'm grateful that we have word from a dentist who sent in information, and then Dr. Bodazadu, he's on as well, who's going to share some thoughts as a Medicaid provider. But first, like I said, we did get an email from a dentist who also was not able to be here tonight. And he wrote, I am a general dentist, having practiced dentistry for 40 years in a not so affluent town in Rhode Island. The poverty rate there is 21%, and 31% of the residents have Medicaid. I have always accepted Medicaid with no restrictions. I treat the patients the same as all other private insurances and private pay. I do so because I feel I'm obligated to treat all patients in the community I work in. I also get a tremendous feeling of satisfaction and fulfillment in doing so. Many are war veterans who I feel that it is important to give something back for their service to our community. Others are CNAs, nursing assistants, that care for our elderly at low wages, doing exceptionally demanding and thankless work. Having experienced members of my own family spending their final years in an elder care facility, these caregivers are irreplaceable and invaluable. They deserve dental care. Others are just hard workers in low-paying jobs that work for companies that don't offer dental insurance. Then there are others who have significant disabilities which don't allow them to properly support themselves. Many present to me in severe pain, having already called and having been turned down by multiple dental offices. There is nothing in dentistry, or in life for that matter, that can give you more of a feeling of contentment and purpose fulfillment than by using your dental skills to alleviate their pain when they have been turned down by many of your dental colleagues, or have the ability to give them an acceptable smile to eliminate the embarrassment they have endured for years. For me, I prefer the result-driven emergency care dentistry over elective type procedure anyway. There is plenty of them in this patient pool. I feel I can be more creative in using composites to rebuild smiles and occlusion rather than in many cases prepping teeth for crowns. The current Medicaid fees are currently set at approximately 10 to 25% below commercial insurance, although there are some fees like anterior root canals that pay more than commercial. I feel the reduction in fees are more than offset by the volume of dental work these patients need. Much of the stress that my office manager has to deal with is with insurance plans that have deductibles and copays. Also, there exist quite often many different plans under one insurance carrier that cover different procedures. They even have claims that go to different addresses. This is very confusing, to say the least. This is not the case with Medicaid. There are no deductibles or copays. We know exactly what they pay and how much. Eligibility is easy to check. Claims go to one address and are hardly ever rejected. Even with paper claims payments, they are processed within 3 weeks of treatment. Broken appointments, though they do exist more than I would prefer, is probably not much different than any other insurance or private pay. There is always that concern when dealing with government programs that you might be overly audited, which without doubt can be very stressful, but I have not found this to be the case so far. If it has happened, the state has been very reasonable and non-threatening. Lastly, the dental profession can be filled with plenty of stress, i.e. difficult and demanding patients, tricky aesthetic concerns, etc. Treating appreciative and thankful Medicaid patients are not one of them. My job is not to convince any one practitioner to start accepting Medicaid patients. Everyone has to make the decision that is right for them. This just outlines my thoughts and experiences. So just grateful for that dentist to share his thoughts. Okay. I did see Vlad, Dr. Bautizado. Is there anything, I'm grateful for you being on as a Medicaid provider. Is there anything you wanted to share in addition about your experience as a Medicaid provider?
Yeah, absolutely. One thing I've noticed, in order to decrease that no-show rate, I've actually gotten mine in the office well under 10% consistently. And the way I've been able to do that, something like programs like Lighthouse and things to that effect, they have worked phenomenally well. In fact, I had a moment maybe about a month ago where it went down for a week and my no-shows skyrocketed. So that service helps. I mean, I can't even tell you how much, to be honest with you, my wife does all the paperwork, but it's a nominal cost. Just having one patient come in pays for it, truthfully. So that's worked phenomenally well. And then over time, I've established such a rapport with patients. I mean, it's something as simple as nice people know other nice people and bad people know other bad people. So in the very beginning, when I started, let's say with the Medicaid within the program here in Rhode Island, I had some difficulties. You can probably see them in my early reviews. But over time, I just was nice to the nice ones, and I'm sorry, but I booted the not so nice ones. And then over time, it just turned into a more normal practice, which is smooth. And truly, I actually prefer this model. That's kind of why I went into it. Once the patient base trusts you, there's no selling. And as I mentioned, there's no co-payments. Basically, this is what you need, how you need, when you need it, and it gets completed. And it's just less emotional grief on my side. The bills are paid and the patients are helped. So it's a win-win. I had to make a few adjustments to the practice model that I had before, but I would never go back personally. That's just my 2 cents.
Great. Well, thank you very much. We greatly appreciate it. Okay, so we'd like to talk next about some of the concerns we've had. And like I said, tonight is just sort of the beginning of the conversation. As we move forward, we wanted to make these short so that those of you who are attending live, you don't have to attend an extensive meeting. And those of you listening on video, you don't have to listen to an extensive video. So just this evening, I'll just go through some of the concerns we've heard and then also tell you about a toolkit that we're putting together to have resources to help you. We hope these changes can allow current Medicaid providers to continue accepting clients and encourage more dentists to enroll as Medicaid providers. So the adult Medicaid reimbursement rates were increased by the Office of the Governor and the legislature, both of them working together, approved for the first time since 1992. Those new rates went live July 1st, 2022. In addition, we made some updates for clarity to the Medicaid manual. And if those of you who don't know how to find the Medicaid manual, we will be sending out a link to all attendees, and also we'll have it with this video. We want everybody to go and see what else is confusing. What did we not get? So this is an opportunity to try to make it as clear as possible. But also realize that we do have a provider support through Gainwell. Gainwell is the company that provides support for Medicaid, and they have a provider representative. So I showed this slide of the United States to show that we're really fortunate. And again, this is thanks to the American Dental Association and the Rhode Island Dental Association, that we see more and more states have an adult dental benefit. We've been fortunate to have it in Rhode Island, but the goal is to realize that oral health makes a difference in everybody's overall health. And then, like Dr. Miske shared, that it makes a difference for kids as well. So Rhode Island is a state considered with an extensive dental benefit, but we want to make it something that works for dentists and it works for patients as well. Starting in the upper left, the concerns we've heard from providers, we heard about reimbursement. We heard about denied claims. So reimbursement, yes, you'll see that the rates, again, are they ideal? But we tried to make a stake in the sand to have improved rates, because what we had heard, or at least what I had heard from the dental community, is we don't even want to talk about Medicaid because the rates have not been changed in 30 years. Well, now that the rates are improved, we need to look at all of these other issues. Denied claims. Again, I think we're working closely with Gainwell to make sure that claims are paid effectively and that providers' questions are answered. Regarding prior authorization, we hear challenges around that. Again, we're trying to address that speedily. We hear patients can be more time consuming. Well, what we'll be talking about in upcoming presentations is the use of community health workers. Community health workers are individuals who are of the community who have been trained to help patients navigate effectively. We also heard from providers about a necessity to have a significant number of patients with Medicaid. That's your choice. You choose in your practice what works for you. We'll have more in our toolkit when we talk about that, about how to use interpreter services. There are patients who English is not their first language, or patients who may be hearing impaired and need interpreter services. Those services are paid through the Medicaid program, and so we will be providing information to you how to find an interpreter and also how to get reimbursed. Next thing we've heard over and over is about missed appointments. We feel that using community health workers can help with that. Or maybe your staff, maybe your front desk functions as in a bit like community health workers. Can we help them get that training so that they're working with those social determinants of health that create challenges? Our goal is to reduce disparities in oral health outcomes in Rhode Islanders, and your participation, especially if you have a better understanding where those disparities are. There's some great resources in improving cultural competency so that you can work effectively with patients who may not be familiar with the healthcare system. And finally, helping you understand what are the dental benefits. Part of that goes to making the provider manual as understandable as possible. So like I said, we'll be sending out the link and encouraging everybody to review the manual and come back next time where we can discuss what is confusing and what needs better clarification. We hope to bring resources for practice success, how to use community health workers, taking advantage of many of the great resources of the American Dental Association for practice management, proper documentation. We'll have at an upcoming meeting our Gainwell provider representative. And finally, several years back, MSDA, which is the Medicaid Medicare CHIP Services Dental Association, had a learning collaborative in conjunction with the Rhode Island Dental Association. There are 10 modules. Those are still available online. So we'll make sure you know where those are so you can find them. So the bottom line, again, we want you to be successful and satisfied working with adult patients in Medicaid. We want to have easy communication with Gainwell to help facilitate enrollment and answer questions about coverage and claims. And then we want to use community health workers to help those patients who have barriers meeting their health or health-related social needs so that you can help provide culturally appropriate oral health education and information and connect patients with social services as needed. So now I'd like to turn it over to Sophie Assa to talk about our home and community-based services oral health pilot.
Thank you, Sam. I am Sophie Assa. I am the project manager at the Executive Office of Health and Human Services, and I've been working closely with Sam to develop our oral health project, where we will be providing access to preventative oral care services to people receiving care in home and community-based services. I will be referring to that as HCBS going forward, but I just wanted to share with you all, there is an overall incremental change to improve our oral health care services in Rhode Island. And like I said, that all starts with implementing preventative oral care standards within our home and community-based settings. And we really want to utilize the skill set of public health dental hygienists and the advances in teledentistry and mobile dentistry equipment to do so, as well as making sure we are limiting the amount of Rhode Islanders that are using emergency rooms for their oral care. That was mentioned earlier today. the work that was able to be done in Michigan to decrease the number of people using emergency rooms. That's something we really want to bring to Rhode Island. We all know, our emergency departments are not equipped to handle oral care, oral pain complaints. So we are really trying to emphasize the preventative model to prevent this overutilization of emergency rooms, as well as just overall increasing the overall well-being and systemic health of our Rhode Islanders. We also want to support our dental workforce. So this is a continuing process that we have started to work on, and we are going to implement in the first step with specifically our pilot, which will be bringing oral care into home and community-based settings. As you all are aware, people are now transitioning from receiving care in our traditional health facilities like nursing homes and are now able to receive care in their own homes through home health care agencies and maybe having a nurse or a CNA come out and provide them care. So this is really an amazing opportunity to start to bridge that medical and dental gap and start to train our home and community-based services providers about the importance of oral health, explain how this is connected to the health and well-being of their patients and how this can be connected to other long-term issues that their clients have, such as diabetes. We know all of these things are all interconnected. So the first part of this project is connecting with these home and community-based service agencies, training their workforce about the importance of oral health, and then also helping them to increase their oral health literacy amongst their clients. So they're also looking for these things as well, and also encouraging these providers to provide daily oral care to their clients, such as helping them brush their teeth if they, don't have the mobility to do that on their own anymore, or maybe even cleaning their dentures. But this is also just to get them to be aware to look for these things as they do their continual daily care with their clients. And then we also ideally would like to connect these agencies with dental providers that are near the patient's homes as a way to create a more concise way to get those patients to dental providers to get additional services. So all of this is part of our pilot to begin to establish a dental model in our home and community-based settings. There isn't one established now, and we think this is an amazing time to bring this model and make sure that everyone is receiving the preventative services that will have better oral health outcomes down the line. So a secondary part of bringing the oral care model into home and community-based settings is utilizing the positions of public health dental hygienists. As you all know, in Rhode Island, public health dental hygienists have experience working as hygienists in a standard clinic with a dentist, and then they can go and get additional education, and then they have the ability to perform specific preventative services outside of a clinic. Using these public health dental hygienists along with a lot of these mobile dentistry equipment that are made available. We had RIDA had their immediate residency a couple months ago, and there was a great presentation about how a lot of people have been able to use these mobile dentistry equipment. And we think that this can be combined with home and community-based services as a way for dentists to be able to expand their care without not necessarily needing to leave their clinic. This gives the ability of the dentist to be able to see the patient without not having them necessarily have to be in their chair, but you're still able to give care to people where they are. And overall, this just emphasizes the bottom line of we are trying to expand access to preventative services to those in the greatest need. So, a lot of people have difficulty leaving their homes. We are trying to find a way to bring the care to them because even though they are unable to leave, this is care that they all still need. And this is an amazing opportunity to establish this care in a new and in a novel way. And just to summarize that, this is a transformative opportunity to address oral health equity, and we need you as dentists for this to succeed. As it was mentioned by our presenters earlier, it's not necessarily having to take 20, 30, like making half your practice be Medicaid patients. Just taking a handful of Medicaid patients can really make a difference, as so many of them have limited access. And this is just a great opportunity. As Sam said, today is a lot of the just informing everyone of all the information, but in our subsequent sessions, I will provide more information about how to get engaged in the pilot project. This is a funded project. This is about a 2-year funded project, and participation would be greatly appreciated. And I will share more information at later sessions, but that was just a brief overview for you all. Thank you.
That's awesome. Thank you, Sophie. So you can see we are trying to address the oral health needs of vulnerable populations, and using public health dental hygienists will make a difference. but we need to combine that with our efforts to have more participating providers in the adult Medicaid program. So next steps, number one, we're going to share this recording, and we're going to also make sure we share the web address of the Medicaid Dental Provider Manual. And what we're asking you to do is to please review that and then prepare any questions you have about that and also about the pilot project for home and community-based services. That'll be the basis for our next discussion. The dates are December 5th at 5 p.m. and December 19th at 5 p.m. So please tell your friends and colleagues, and we will also be sending more information out. And again, very grateful for the partnership of Christy and the Dental Association for sending those emails out as well. We'll let everybody have a few more minutes. We want to thank you again. Thank you again to James Rajat, Chief Strategy Officer at EOHHS, for the very inspirational words you brought at the beginning, the word from the Secretary. Thanks to Sadie DeCourcy of the Oral Health Program for all the wisdom you share at the meetings. And thanks to Sophia Sa for her continued hard work and dedication. And a big thank you. And I want to, for all of you on this call and all of you who are listening to the video, and I want to wish everybody a happy Thanksgiving. Have a good night, everybody.